AI agents for addressing the healthcare system challenge of fragmented care pathways, enhancing coordination, communication, and continuity. Healthcare systems worldwide are struggling with the long-standing challenge of fragmented care pathways. Fragmentation, manifested in disjointed communication, duplicated services, and inconsistent patient experiences, results in suboptimal outcomes, increased costs, and clinician burnout. This article explores how AI agents are emerging as a transformative force in overcoming these challenges. Designed with capabilities such as autonomous reasoning, contextual memory, continuous learning, and multimodal data integration, AI agents are uniquely suited to serve as the connective tissue in modern care delivery systems. We outline their ability to enhance coordination, streamline communication, and ensure longitudinal continuity of care. 2 mental health platforms, the Concierge Services Platform and the Pre-Treatment Digital Patient Engagement Platform, serve as case exemplars demonstrating the tangible impact of AI agents in restructuring care delivery models. These systems move AI from the realm of automation to infrastructural intelligence, setting the foundation for scalable, patient-centered, and value-driven care. 1. Fragmentation as a systemic barrier. Healthcare systems globally are facing a persistent, deeply embedded challenge, the fragmentation of care. This problem manifests as a lack of synchronization between various actors and systems across the care continuum. It results in disjointed clinical workflows, poor information transfer, and a breakdown in the patient journey, from first contact, to diagnosis, to treatment, and through to recovery or long-term management. This fragmentation undermines care quality, inflates costs, exacerbates clinician burnout, and, most critically, leaves patients vulnerable to suboptimal outcomes and emotional distress. Amid these complexities, AI agents are emerging not as ancillary tools, but as core components in the re-architecture of healthcare systems. Equipped with the ability to reason autonomously, remember context, continuously learn from new data, and interact across both human and machine interfaces, AI agents are uniquely positioned to resolve the problem of fragmented care at its root. 2. Enhancing coordination. Orchestrating complex and distributed care pathways. Coordination in healthcare refers to the deliberate organization of patient care activities and information sharing among all participants concerned with a patient's care. In practice, however, this ideal is often undercut by isolated provider systems, disparate IT infrastructure, and episodic intervention models. AI agents enhance coordination by serving as orchestration layers that bridge disparate components of the healthcare system. They connect EHR systems, wearable devices, patient-reported outcome tools, and provider calendars into unified workflows. Designed with modular APIs and interoperability in mind, AI agents synchronize data across institutions, enabling specialists, primary care teams, behavioral health providers, and patients to work from a shared and current understanding of care needs. More importantly, AI agents provide dynamic, real-time coordination. For example, when a patient is discharged with multiple follow-up needs, rehabilitation, medication management, mental health support, an AI agent can generate a coordinated care plan, schedule services across providers, and push notifications tailored to clinician and patient schedules. These agents function as scalable extensions of care coordination teams, reducing gaps and accelerating transitions across settings. 3. Transforming communication. Real-time, contextual, and bidirectional information flow. In fragmented systems, communication is often asynchronous, incomplete, and unstructured. Providers rely on delayed EHR entries, faxed documentation, and patient self-reporting to reconstruct a patient's status. Meanwhile, patients experience confusion and disengagement due to the lack of timely updates and comprehensible information. AI agents enable real-time, context-aware communication by monitoring clinical events, detecting anomalies, and triggering alerts or decision support. A patient showing signs of deterioration can receive proactive outreach, while the care team is simultaneously updated. These agents enhance bidirectional communication by processing patient-generated data through conversational interfaces and synthesizing it into clinically relevant summaries accessible across the care team. AI-driven communication systems do more than digitize messages. They interpret urgency, infer context, and route insights to the right recipient. This intelligent mediation ensures no critical information is lost and no opportunity for intervention is missed. 4. Sustaining continuity. Intelligent companionship across the care journey. Continuity of care refers to delivering healthcare services in a coherent and connected manner over time. In fragmented models, continuity suffers due to episodic care delivery and lack of memory across touchpoints. This particularly affects patients managing chronic conditions, mental health disorders, and complex care plans. AI agents act as digital companions, maintaining engagement and clinical oversight between human-led appointments. They support daily check-ins, monitor behavioral patterns, and detect disengagement or decline. Over time, these agents develop a contextual memory of the patient's needs, preferences, and treatment responses, ensuring consistency even if clinicians change. By generating personalized digests for new providers and detecting early signs of disengagement, AI agents preempt drop-offs and foster relational continuity. In doing so, they uphold a proactive model of care where patients are supported not just during visits, but continuously. 5. Case applications. AI agents in mental health. To ground this framework in practical application, 2 AI-powered platforms, concierge services and pre-treatment engagement, illustrate how agents operationalize coordination, communication, and continuity. 5.1. Concierge Services Platform. Sustained coordination through ambient intelligence. The Concierge Services Platform for mental health addresses fragmentation between therapy sessions. Using sentiment analysis, conversational AI, and predictive analytics, the embedded AI agent monitors emotional tone, physiological data, and interaction patterns. It functions as a digital companion, initiating check-ins, scheduling sessions, and triggering escalations based on risk signals. This embedded intelligence supports clinicians by managing the care environment dynamically, ensuring continuity even outside of formal encounters. 5.2. Pre-treatment digital engagement platform. Rewiring the point of entry. Fragmentation often begins at intake. The pre-treatment digital patient engagement platform addresses this by embedding an AI agent that conducts adaptive assessments using natural language dialogue. It builds rich patient profiles and facilitates precise therapist matching based on clinical needs and personal preferences. The agent schedules appointments, collects ongoing feedback, and adjusts care plans accordingly, transforming intake from a transactional to a relational process. 6. Reinforcing the framework. Platforms as proof of principle. These 2 platforms exemplify how AI agents embody the core pillars of system transformation. They demonstrate that agents can serve both as coordination infrastructure and as relational interfaces, combining data orchestration with human-centered design. These platforms do not merely digitize processes, they humanize systems. They also highlight the scalability and generalizability of the AI agent model. Whether in mental health, chronic disease management, or complex surgical recovery, AI agents offer a replicable blueprint for achieving systemic integration. From possibility to practice, designing health systems around intelligence. In this future, AI agents are not layered onto fragmented infrastructures, they are the architecture upon which coordination, communication, and continuity are built. They serve as connective tissue in systems long plagued by siloed data, episodic engagement, and fragmented accountability. Crucially, they do not replace clinicians but empower them to operate within a more responsive, intelligent, and patient-aware ecosystem. The concierge services and pre-treatment engagement platforms underscore that AI agent-powered transformation is not only feasible, it is actionable and underway. They serve as case-based blueprints for a broader rethinking of care delivery. As AI agents continue to mature, they will not only bridge historical gaps but proactively reshape how care is structured, delivered, and experienced. A coordinated, compassionate future enabled by intelligence. Healthcare fragmentation stems from structural limitations, not lack of effort. As health systems become more complex, the need for intelligent infrastructure becomes urgent. AI agents are emerging as foundational to this redesign, connecting the disjointed, supporting the overwhelmed, and remembering the forgotten. They do not replace clinicians, but empower them to work within environments that are coherent, responsive, and patient-centered. The concierge and pre-treatment platforms show that this future is not speculative. It is present and expanding. AI agents are no longer mere tools of automation, they are the architects of continuity, enabling a system that cares as intelligently as it heals. In doing so, they offer healthcare not only efficiency, but empathy encoded in infrastructure.